Hello and welcome. I'm Dr. Husain with the Associated Ophthalmologists. Thank you for taking the time to learn more about cataract surgery and the exciting new technology that can restore the quality of your vision and enhance your lifestyle. With today's outpatient cataract surgery techniques, using no needle, no stitch surgery, patients enjoy quick recovery and excellent post-operative vision. It is important to remember that your vision is precious and you will have cataract surgery only once in your lifetime. Therefore, it is important for you to consider the best lens implant for your eyes. My recommendation is that you listen to this program carefully before we meet for your appointment, and then together we will select the lens option that will best fit your needs. In this program, you will learn about the new lens options available to you, and you will also hear from other cataract patients who will share their personal experiences with you. At the Associate Ophthalmologists, we are committed to providing you with the highest quality of care and look forward to helping you restore the quality of your vision. If you have any questions at the conclusion of this program, please speak with me or a member of my staff. Thank you.
The main thing that really affected me was not being able to put my grandchildren in the vehicle with me, since I was actually afraid to do that. I was afraid I might get in an accident.
If I didn't wear glasses, I couldn't read. And no matter if I held a book or magazine or whatever.
I knew there was something wrong with my eyes when I went up the mall and everybody's face was fuzzy. It frightened me a little, so I turned around, went home, called the doctor.
Everything was blurry. My eyes hurt. I mean, just from being sensitive to light. We found out through my doctor's testing that I had cataracts in both eyes.
A cataract is the clouding of your eye's lens that occurs naturally as we age. It may be why sharp objects appear blurry, colors look dull, and why you may have trouble seeing at night.
I had trouble seeing road signs. I would be right up on a road before I saw the sign to know that I was supposed to turn there, because you just couldn't focus. Well, when I realized that my eyesight was not what it should have been, I was actually afraid that I was losing my sight.
I had gotten to the point where I was not very confident in riding my bike anymore because I was afraid that I'd run into something.
You could say, oh gosh, that's probably Mary, but maybe it's not, But you waved anyway.
I'm on the computer a lot in my work. I would prop my computer up in the back to make, I'd sit as high as I could. It just didn't work, and I just had a problem seeing. I had to sit right on it, even with I'm talking about with my glasses on.
After he had his eyes examined, and he came out and he said, well, doctor thinks the cataracts are ready to come out.
I had some tests done at his office. He explained the whole procedure to me. He told me what I could look forward to. He gave me some options.
You go in and they give you the pre-op. They give you a intravenous and put all kinds of drops and everything in your eye.
I know medicine has come a long way. I knew it was going to be a relatively easy procedure, but I was surprised at really what an easy procedure it was.
The only way to correct cataracts is with surgery. The good news is that cataract surgery is one of the safest and most effective procedures performed today. Your doctor will make a tiny incision in your eye using an instrument about the size of a pen tip to gently separate and remove the cataract. Once it's removed, a new lens is inserted that unfolds into its permanent position.
It was so easy. It was just a series of eye drops, maybe 3 days before, and the day of the surgery. It was in and out in 2 hours.
The recovery process was like this. This morning, after I had the second eye surgery, I was bad. I took the pad off my eye and drove myself to the doctor. And I was like a 6-year-old child who had just learned to read. I was reading every sign that I couldn't see before. It was wonderful. I was so hyped up by the time I got there.
Your vision after surgery will depend on the cataract lens you and your doctor choose. With the introduction of the Acrosoft Restore lens, your options have never been better. Unlike traditional lenses, the breakthrough Acrosoft Restore lens lets you see near, far, and everywhere in between. The big picture and the details.
I read a lot. So that was one of the things that was important to me, is the ability to read. And he explained to me that this particular kind of lens, Restore, if that was implanted, then I would not need glasses to read. That's what I chose. And guess what? I don't need glasses to read. And nor do I need glasses to see far away.
I see everything. I see all the lint in the house. If something's wrong, I can see it. I don't know if that's good or bad, but I do. I see everything. I realize now that how much I was missing before I had my surgery.
I have a friend that's an artist. And when we would go out for walks or for rides, she would say, "Do you see the different shadings in the trees and the mountains?" And I didn't want to hurt her feelings, but I didn't see anything. I saw color, flat color with no dimension. After the surgery, I saw the deep greens and the light grays. It was just so different to see everything.
If you have astigmatism, your eye doctor may recommend another advanced lens called Acrosoft Toric.
If you have the surgery for the cataracts and you have a toric lens put in, you're doing both. You're having your astigmatism corrected as well as having the cataracts removed.
The Acrosoft Toric lens works with the abnormal curvature of your eye to correct the blur caused by astigmatism and the fog caused by cataracts. The only time most patients need glasses is for reading. Your eye doctor will help you decide which lens is right for you.
If somebody has cataracts and an ophthalmologist recommends that they be removed, well, you have them removed. And then as far as the choice of the lens is concerned, I certainly would recommend the Restore.
The riding the bike, it's made a big difference. All my confidence has come back. The toric lens has been really, I don't know, I can't say enough good about it.
It has affected my life personally. Every way you can imagine. I never expected to be able to see everything like I do. Without glasses, I don't even have any. I don't even own any. I don't have to have, they're just like new eyes.
I think you become accepting of what you're seeing, and you don't really know what the opportunities are to make it better until you actually have it done.
It's a shame to go through life not being able to see well when this is available. The news really needs to get out. The Restore lens has restored my eyesight.